Hello students, welcome back to my channel. Today I am going to discuss some important questions on respiratory system and sound production, right? For NEET aspirants and other competitive examination. If a man from sea coast of Kerala goes to Mount Everest, his breathing rate will and heartbeat will increase, his breathing rate and heartbeat will decrease, his breathing rate will increase but heartbeat will decrease, his breathing rate will decrease but heart will be increase. First option is correct. His breathing rate and heartbeat will increase. If a person stays on Mount Everest for some days, his body will step down production of red blood corpuscles. His body will step up production of red blood corpuscles. Number of red blood corpuscles will not change. His red blood corpuscles will turn into very large cells. Second option, his body will step up production of red blood corpuscles. Now the next one, how is oxygen transported by blood in vertebrates? Adsorbed on the surface of RBCs, combined with hemoglobin, dissolved in plasma, all the above ways. All the above ways. Body tissues obtain oxygen from oxyhemoglobin because of its dissociation caused by low oxygen and high carbon dioxide concentration, low oxygen concentration, low carbon dioxide concentration, high CO2 concentration. It is low oxygen and carbon dioxide concentration. If oxygen concentration in tissues were almost as high as at the respiratory surface, then oxyhemoglobin would dissociate to supply oxygen to the tissues. Hemoglobin would combine with more oxygen at respiratory surface. Oxyhemoglobin would not dissociate to supply oxygen to the tissues. Carbon dioxide will interfere with oxygen transport. The third option will be correct. Oxyhemoglobin would not dissociate to supply oxygen to the tissues. During hibernation, frog respires by external gills, lungs and buccopharyngeal lining, external gills and lungs, moist skin only. It is moist skin only. Which fact suggests that most oxygen is transported from lungs to the tissues combined with hemoglobin rather than dissolved in blood plasma. Oxygen's carrying capacity of whole blood is much higher than that of plasma, and oxygen content of blood leaving the lungs is greater than that of blood entering the lungs. Hemoglobin can combine with oxygen. Oxyhemoglobin can dissociate into hemoglobin and oxygen. Increase in carbon dioxide concentration decreases the oxygen affinity of hemoglobin. First option is correct, that is oxygen carrying capacity of whole blood is much higher than that of the plasma, and oxygen content of blood leaving the lungs is greater than that of blood entering the lungs. The blood leaving the lungs has all its hemoglobin oxygenated and gives up oxygen to the tissues because the tissues can absorb oxygen from oxyhemoglobin. Oxygen concentration in tissues is higher than carbon dioxide. Carbon dioxide concentration lower than in lungs. Oxyhemoglobin undergoes reduction. Oxygen concentration in tissues is lower and carbon dioxide concentration higher than in lung. Fourth option is correct. Oxygen concentration in tissues is lower than carbon dioxide concentration higher than in lungs. During one circuit of blood from lungs to the tissues and back through circulatory system, the percentage of hemoglobin giving up its oxygen to tissues is 50%, 75%, 25%, 100%. It is 25%. When man inhales air containing normal concentration of oxygen but also carbon monoxide, he suffers from suffocation because carbon dioxide reacts with oxygen, reducing percentage of oxygen in the air. Hemoglobin combined with carbon monoxide instead of with oxygen, and then product cannot dissociate. Carbon monoxide affects the diaphragm and intercostal muscles. Carbon monoxide affects the nerve of the lung. Second option is correct. Hemoglobin combines with carbon monoxide instead of the with oxygen, and the product cannot dissociate. Combining of hemoglobin with oxygen in lungs can be promoted by decreasing oxygen concentration in blood, increasing oxygen concentration in blood, increasing carbon dioxide concentration in the blood, introducing carbon monoxide in the blood. First option, decreasing oxygen concentration in the blood. Oxygen carrier or the respiratory pigment in blood of frog and other vertebrates is hemocyanin, hemoglobin, cytochrome, none of them. It is hemoglobin. Now the next one, the largest quantity of air that can be expired after a maximum inspiratory Effort is residual volume, tidal volume, vital capacity of lungs, lung volume. It is vital capacity of lungs. A frog must swallow air to expand the lungs because frog has no diaphragm, normally breathes through its skin, have no vagus nerve, it relatively low form of life. It has no diaphragm. The lungs in frogs are compact spongy masses, thick-walled non-elastic hollow bags, thin-walled elastic hollow bags, none of them. Thin-walled elastic and hollow bags. Anaerobic respiration is likely to occur in ants, earthworm, echinoderms, tapeworm. It is in tapeworm. Tidal air in mammals is total maximum air that can be drawn into lungs, air that normally goes in and comes out of lungs during breathing, air that is left in lungs after normal expiration, air that can be expelled out from lungs forcibly from after normal exercise. Second option is correct. Air that normally goes in and comes out of lungs during breathing. Cellular respiration in rabbit occurs in cells lining the lung cavities, cells contained in the blood, cells lining the gut, all live cells of the body. All live cells of the body. Mammalian lungs contain an enormous number of minute alveoli. This is to allow more space for increasing the total volume of inspired air, more surface area for diffusion of gases, more spongy texture for keeping lungs in proper shape, more nerve supply to keep the organs working more efficiently. Second option is correct, more surface area for diffusion of gases. Oxygen transported in blood mainly by blood plasma, leukocytes, erythrocytes, thrombocytes. It is by erythrocytes. Number of RBCs per unit volume of blood is likely to be higher in a person living at higher altitudes because air is clean and unpolluted, air is less dense, more sunshine is available, vegetation gives out more oxygen. Air is less dense. In which form carbon dioxide is mostly carried in blood? Bicarbonate ions in the plasma, sodium carbonate in plasma, carbonic acid in plasma, carbamino, carbaminohemoglobin RBCs. Bicarbonates ions in plasma is the right answer. Breathing is controlled by lungs, trachea, medulla, intercostal muscles. It is by medulla. Oxygen content in the air we expire is 4%, 20%, 25%, 16%. It is 16%. The medullary respiratory center is directly affected chemically, physically, neuronally, none of the neuronally. The respiratory center may release motor impulse of faster breathing due to venous blood entering into it, venous blood leaving it, arterial blood entering into it, arterial blood leaving it. Second, arterial blood entering into it. Forced deep breathing of a few minutes by a person at rest may be followed by a temporary cessation of breathing because of too much oxygen in blood, too much carbon dioxide in blood, little CO2 in blood, both too much O2 and very little CO2 in blood. It is fourth option is correct. Both too much O2 and very little CO2 in blood. Now the next one, the impulse for voluntary forced breathing starts in medulla, vagus nerve, spinal cord, cerebellum. It is in cerebellum. Faster breathing in high fever is due to additional requirement of oxygen for the invader germs, high temperature of the body, mental worry about the patient, loss of appetite. It is due to loss of appetite. Sudden deep inspiration may be due to increase in oxygen concentration, increase in carbon dioxide concentration, decrease in carbon dioxide concentration, increase or decrease in carbon dioxide. It is increase in carbon dioxide concentration. Major fraction of carbon dioxide released during cellular respiration is transported in blood to the lungs in the form of bicarbonate HCO3, H2CO3, as free CO2 in combination of lead carbon, HbCO2. First, that is by the HCO3 minus. Controlling center of normal breathing in mammals lies in cerebrum, cerebellum, midbrain, medulla oblongata. It is medulla oblongata. During respiration, the diaphragm relaxes to become dome-shaped, contracts and flattens, expands, shows no change. Contracts and flattens. Number of lobes in right and left lungs of rabbits are 2, 4, 1, 2, 4, 2, 6, 3. It is 4, 2. Structure which does not contribute to the breathing movements in mammals is ribs, diaphragm, abdominal muscles, larynx. It is larynx. One common feature between trachea of rabbit and trachea of cockroach is that both are paired and branched, have ciliated epithelium, have non-collapsible walls, originate from pharynx in head region, have non-collapsible walls. Especially common in the alveoli of lungs and villi of intestine in mammals is that both provide of large surface area, are highly suited for diffusion of gases, have rich supply of blood vessels and lymph ducts, have ciliated epithelium. First option is correct, provide a large surface area. Ciliated epithelium in trachea of mammals helps in sucking inspired air in, perceiving sense of smell, pushing expired air out, pushing mucus out. It is pushing mucus out. Which one of these statements is correct? All animals require a medium for cellular respiration. In all animals, oxygen is transported by blood. All animals take oxygen from water or air through gills or lungs. All animals need oxygen for respiration. First option is correct. All animals require a medium for cellular respiration. If a person living at sea level migrates to about 8,000 feet high hill, his blood after about 15 days will increase in volume, have fewer WBCs, have greater number of RBCs and more hemoglobin, have poor plasma, have greater number of RBCs and more hemoglobin. Which statement is correctly defines Bohr effect? Rise in P50 with a decrease in CO2 concentration, rise in P50 with an increase in CO2 concentration, rise in P50 with an increase in pH and decrease in PCO2, fall in P50 with a decrease. Second option is correct, rise in P50 with an increase in CO2 concentration. When under certain conditions, the P50 value of hemoglobin rises, the affinity of the pigment of combined with O2 will retain the same, fall, rise, first, fall, rise, then fall. If under certain conditions the P50 value of hemoglobin rises to 100 mmHg, a person will die of oxygen deficiency because the pigment is not loading oxygen in the lungs, can load enough oxygen in lungs but cannot unload it in tissues, can neither load nor unload oxygen. Oxygen suffers degradation and cannot function normally. Is not loading enough oxygen. First option is correct. Under a given oxygen concentration in blood, dissociation of oxyhemoglobin will increase. If pH of blood rises, pH of blood falls, CO2 concentration in blood falls, free fatty acids concentration in blood fall, pH of blood fall. Covering of the lungs is called pericardium, perichondrium, peritoneum, pleural membrane. It is pleural membrane. Breathing rate is lowest while we are playing tennis, delivering orders, sleeping, eating. It is in sleeping. The percentage of oxygen in inhaled air is about 21%, 16, 79%, 4%. It is 21%. The blood coming out of lungs is richer than entering into the lungs in CO2, O2, both, none of both. When partial pressure of carbon dioxide rises, the oxygen dissociation curve of hemoglobin at 37 degrees centigrade will shift towards right, shift towards left, become irregular, remain unchanged, shift towards right. Thyroid cartilage is found in ear, pinna, nose, larynx, pharynx. It is in larynx. In frog, glottis is controlled by mucus of vocal cords, sternum, arytenoid cartilage, pectoral girdle. It is arytenoid cartilages. About how many times per minute a man normally respires? 12 to 15, 40, 70 to 100, 12 to 15. Which one of these in blood absorbs oxygen in respiration? WBC, plasma, RBC, platelet. It is RBCs. How many molecules of oxygen can associate with the molecule of hemoglobin in man? 1, 2, 3, 4. It is 4. RQ means volume of oxygen consumed per minute, volume of carbon dioxide consumed per minute, ratio of carbon dioxide output and oxygen intake, increase in oxygen intake with rise in depth. It is ratio of carbon dioxide output and oxygen intake. RQ of carbohydrate will be 1, 1.5, 0.5, 0.8. It is 1. Tidal volume in human beings is 1500 ml, 800 ml, 500 ml, 1200. It is 500 ml. What would happen if human blood becomes acidic? Oxygen carrying capacity of hemoglobin decreases, oxygen carrying capacity of hemoglobin increases, RBC counts lead, RBC counts decreases. Oxygen carrying capacity of hemoglobin decreases. Which structure is not related with respiration in frog? Diaphragm, lungs, skin, buccal cavity. It is diaphragm. In frog, respiration occurs by trachea, lungs, both, gills only. It is lungs. Respiration in rabbit is helped by pelvic girder, intercostal muscles, biceps muscles. None of this. It is intercostal muscles. Even when there is no air in it, human trachea does not collapse due to presence of turgid pressure, cartilaginous rings, chitinous rings, bony rings. It is cartilaginous rings. Which of these contains vocal cords, larynx, pharynx, glottis, bronchial tube? It is larynx. Chloride shift is essential for transport of carbon dioxide and oxygen, nitrogen, carbon dioxide, oxygen, carbon dioxide. Third option. Amount of oxygen normally carried by 100 ml of pure blood, 40 ml, 20 ml, 10 ml, 30 ml. It is 20 ml. Hemoglobin oxygen associate curve is hyperbolic, sigmoid, constant state. It is sigmoid. Epithelial lining of the alveoli of frog's lungs facing lung cavity is squamous ciliated, squamous non-ciliated, columnar non-ciliated, columnar ciliated. It is columnar ciliated. In which of these skin serves as an accessory organ of respiration? Rabbit, frog, lizard, birds. It is in frog. Carbonic anhydrase is found in leukocytes, lymphocytes, blood plasma, erythrocytes. It is in erythrocyte. pH scale is used to measure size of ions, concentration of hydrogen ions in a solution, electric charges on ions, speed of with which ions move, concentration of hydroxyl ions in a solution. Hamburger shift is also called hydrogen shift, HCO3 shift, chloride shift, sodium shift. It is chloride shift. Site of gaseous exchange in lungs is tracheoles, alveoli, bronchioles, pulmonary chambers. It is alveoli. Exchange of gases between blood and alveolar air in lungs occupy simple diffusion, osmosis, active transport, all of this. It is simple diffusion. Volume of air inspired and expired in each breath in normal respiratory by man is called total lung capacity, tidal volume, residual volume, inspiratory capacity. It is tidal volume. In frog, cutaneous respiration takes place only on land, only in water with pulmonary respiration, only in water when pulmonary respiration is not occurring always. It is always. Contraction of sternohyal muscles during breathing in frog is closes the glottis, lowers floors of oral cavity, raises floors of oral cavity, opens nostril, lowers floor of oral cavity. In which condition oxygen dissociation curve of hemoglobin shifts to the right of normal curve? Decrease in pH, decrease in carbon dioxide concentration, decrease in acidity, decrease in temperature. It is decrease in pH. In mammals, carbon dioxide is transported from tissues to respiratory surface by red blood corpuscles only, red and white blood corpuscles, plasma and red blood corpuscles, plasma and red blood corpuscles only. In expiration, diaphragm is flat, concave, relaxed, arched. It is relaxed. Epithelial lining of respiratory system of frog is derived from ectoderm, mesoderm, endoderm, and mesoderm, endoderm. It is from endoderm. Rate of breathing in mammals largely depends upon oxygen concentration in blood, carbon dioxide concentration in blood, volume of oxygen in trachea, extent of depression of diaphragm. It is carbon dioxide concentration in the blood. In man and mammals, air passes from outside into the lungs through nasal cavity, larynx, pharynx, trachea, bronchi, alveoli, nasal cavity, larynx, pharynx, trachea, bronchioles, alveoli, nasal cavity, pharynx, larynx, trachea, bronchioles, bronchi, alveoli. Last option is correct. It is nasal cavity, pharynx, larynx, trachea, bronchi, bronchioles, alveoli. Hemoglobin forms a stable compound with CO, which may be fatal for a person. Death in such cases may be attributed to too much carbon dioxide accumulating in the blood, non-availability of oxygen to tissues, stoppage of glycolysis in body cells, increased retention of urea in blood causing uremia. Second option is correct, non-availability of oxygen to tissues. Vocal cords are made up mostly of bone, cartilage, elastic fibers, collagen fibers. It is elastic fibers. In resting condition, frog respires by skin, buccopharyngeal cavity, lungs, skin, and buccopharyngeal. It is skin and buccopharyngeal cavity. Respiratory quotient is less than 1 for organic acids, fats, carbohydrates, protein. It is for fats. Although much CO2 is carried in blood, yet the blood does not become acidic. This is because in CO2 transport, blood buffers play an important role. CO2 combines with H2O to form H2CO3, which is neutralized by sodium carbonate. Carbon dioxide is continually diffused through the tissues and is not allowed to accumulate. Carbon dioxide is absorbed by the first option is correct. In CO2 transport, blood buffers play an important role. Division of mammalian lungs into a very large number of tiny alveoli around alveolar ducts opening into bronchioles is An efficient system of ventilating the alveoli resulting in very high percentage of residual air in lungs. An efficient system of ventilating the alveoli through with very little residual air. A very efficient system of ventilating the alveoli with no residual air. An efficient system of ventilating the alveoli with little or no residual air. First option is correct. An efficient system of ventilating the alveoli resulting in very high percentage of residual air in lung. The toxic effect of carbon monoxide is due to its greater affinity of hemoglobin as compared to oxygen by approximately 200 times, twice, 1000 times, 20 times. It is 200 times. Most stable product is formed by hemoglobin with CO2, COO2, SO2. It is with CO. Anemia is caused due to several serious reasons, one of which is that more hemoglobin is formed. Methemoglobin is formed due to pollution. Hemoglobin does not get adequate supply of oxygen due to pollution. More of carbon hemoglobin. Third option is correct. Hemoglobin does not get adequate supply of oxygen due to pollution. That is all about it. Again, we will meet in the next video with more important question for your competitive exams as well as NEET aspiration. Thank you, children.